On to health. Doctors at various public health facilities across the country are facing a difficult time in diagnosing and treating diseases as medical data records of patients dating as far back as 2020 have been lost following the shutdown of the Lightwave Health Information Management System. Government announced the introduction of a new electronic data system, the Ghana Health Information Management System, after it claimed contractors of the old data system failed in delivery of their mandate of mapping over 900 health facilities onto the platform, among other contractual breaches. Emmanuel Bright-Kweku reports the 3-week shutdown of the system is frustrating the works of the health professionals, as many risk misdiagnosing and managing diseases poorly as they now resort to exercise books and other manual alternatives to enter medical records.
For at least 3 weeks now, health professionals across Ghana's public health facilities have had to bear the drudgery of manually entering data of patients. From resorting to folders and exercise books, the shutdown of the Lightwave Health Information Management System is presenting dire consequences to the health sector. Aside from the long winding queues witnessed at the hospitals as patients seek medical care, a stark reality of medical data loss is threatening quality healthcare delivery. Dr. Elliot Cranton-Tano is a nephrologist at the Konfanoti Teaching Hospital. He highlights the challenges the situation is posing to his work.
And we had to virtually tell the patient that, listen, we are unable to assess, so those of you who have ever come, you may have to go. And those who remember your medications, then we may have to now write your own medications. Now the question is, for me as a nephrologist, whatever has happened to your kidney function, whether it's improving or getting worse, I will be able to tell if I'm able to see what your last lab result was. But now even if you present today and your creatinine is say 200, the question is, I cannot be hard on you because I don't know whether you have come from 300 to 200 or you have probably from 100 to 200, if you understand what I'm trying to say. So the difficulty is the fact that if you don't have the record, you will not even know what you are managing because you don't know the diagnosis. The diagnosis is not in our heads. This is on OPD basis. Let's come to admissions. It's even worse. On admission now, currently, we are writing in exercise books. In fact, when they brought the exercise book at first, some of us thought, okay, maybe it's just for a few days. And for some time, it's exercise books. Because technically, and everybody listening to this or watching this should bear in mind that it is your mother, it's your father, it's yourself and your data that is at risk. So there has to be a way that we will be able to get this data to be able to help the patient. Otherwise, our hands are tied.
Health Minister Kwabena Mintah-Kando announced plans by the government to introduce a new system, the Ghana Health Information System, after he found the contractors of the old system failed to deliver on their mandates. But these questions continue to linger on the minds of the health practitioners.
So now the question is, we have LIMS cards for these patients. Are we going to now get new cards for these ones? How do we link the new cards to the GIMS card and be able to ensure there's continuity of care? Why we have folders, and again, for me, it's disappointing that gone are the days when we were using folders. I think now the folders are becoming more reliable because now we're going back to the exercise book, which is like the folder, than when now we are using electronic medical records, which was supposed to be more reliable. That one day a company says, or maybe a government says, okay, now I don't want this old one again. And then, or a new one comes and says, okay, I also don't want GIMS because there was whatever I just like. Then what are we doing to ourselves as a country? And this medical record or data of our patients, it's sacrosanct. It's like so important. Without the data, we are useless. We cannot manage them.
The situation is also threatening data for medical research.
To make matters even worse, there are a lot of studies that are going on that requires this data. All right, so there are researches that are more of retrospective data where we can go onto the system and we know it is there, so we can at least follow up a patient for 5 years or 3 years or 2 years. Now, where is the data? So a lot of grants or a lot of research that are relying on these data are going to suffer.
For the medical officers, they want an immediate restoration of the data system to better manage their patients. For Joy News, my name is Emmanuel Bright-Kweku.